my tummy again. Oh, why this pain now? Why am I always having this pain every month? Oh my God, what can I do? Well, you are welcome back to my channel. My name is Alex Olafusikolawole. This is Pencilanderaserchannel. Well, that intro is the agony, is the pain people pass through every month when having their menstruation. And today we'll be talking about painful menstruation. Painful menstruation or painful menses. It is called dysmenorrhea in medical term. Dysmenorrhea. What is dysmenorrhea? Dysmenorrhea is cyclic abdominal pain and uterine cramping associated with ovulatory menstrual cycles. Let me take it again. Dysmenorrhea is cyclic abdominal pain and uterine cramping associated with ovulatory menstrual cycles. It is a colicky pain in the lower abdomen and pelvis around the time of menses. It is a colicky pain in the lower abdomen and pelvis around the time of menses. Okay, what it means is this, that is painful. Menorrhea means menstruation. So painful menstruation, painful menses. So whatever the name you want to call it, it is painful menstruation. The pain you feel around your menstruation, around your menstrual, around the time of your menstruation is very painful. It is called dysmenorrhea. Normally most people have their menstruation without notice, but in some people it is always associated with pains and serious pain. That I don't want to use the word agony, but it is associated with pains, and it is called dysmenorrhea. Dysmenorrhea. Let's go to some epidemiology. Primary dysmenorrhea occur in 50% to 80% of menstruating female. Yes, about 50 to 80% of menstruating female, that is female that are having menstruation, always experience primary dysmenorrhea. We shall be talking about primary dysmenorrhea, secondary dysmenorrhea, and other type of dysmenorrhea that we know. The second one is adolescents. Yes, people from that are adolescents that suffer this painful menstruation ranges between 20 to 90%. It is that serious, and everything must be done to correct or to relieve their pain. Another thing to note is that the onset is usually within 6 months to 2 years of menarche. Menarche is your first menstruation. The first menstruation is called menarche. So after about 6 months to 2 years, ladies begin to have primary dysmenorrhea, whereas secondary dysmenorrhea occur later in life, and it is associated with disease condition. So that tells you the difference between the two. Maybe you've been having your menstruation as a woman before, you've been having your menstruation, no problem, but you get to certain age, you begin to have serious painful menstruation. Then you need to investigate. You need to go to hospital. You need to go and see your doctor to investigate it for you. It is called secondary dysmenorrhea. It is caused by a disease condition in the uterus or around the female reproductive system. Now, this is also important. This condition is associated with increase in prostaglandin level. Prostaglandin level. That's we have the PGF2, PGE2. It is increase in the prostaglandin level that is associated with spasm of the smooth muscle of the uterus that leads to painful menstruation. Now let's move further. Like I said earlier, I said it might either be primary or secondary. So dysmenorrhea is divided into two. It is divided into primary dysmenorrhea and secondary dysmenorrhea. And don't forget, I also talk about other types. We also have another type of dysmenorrhea that is called membranous dysmenorrhea. Maybe you are hearing that for the first time, but that is the truth. We have membranous dysmenorrhea. Okay, what is primary dysmenorrhea? Primary dysmenorrhea does not have anatomic causes at all. It just starts. Not that you have a fibroid, you don't have a PID, and don't forget that I said it usually starts between 6 to 2 years of your menarche. That's the first menstruation. Whereas secondary dysmenorrhea results from a known pathological process occurring within the pelvis. Secondary dysmenorrhea results from a known pathological process occurring within the pelvis. Now, this is another fact. The prevalence rate of primary dysmenorrhea is around 40 to 90%, and we have an average of 75%, and occur mostly in younger women of around 25 years. So please note that. Causes: we have a tissue hypoxia and ischemia. When there is less oxygen to a particular part of the uterus, you may have pain. Okay, now let's look at how primary dysmenorrhea is diagnosed. It is diagnosed through physical examination. Like I said, it begins within 6 months to 2 years of your menarche or your first ovulatory cycle. So as ovulation become established after 6 months of your first menstruation, you may begin to have painful menstruation called dysmenorrhea. So the first thing to do is physical examination. You go to your doctor, they will ask you some questions when you do start your menstruation and so on and so forth. Please make sure you give them correct answer. It is also to be noted that this pain occurs only during ovulatory cycle and lasts about 48 to 72 hours each month. It lasts between 2 to 3 days each month, and it occurs only during ovulatory cycle. So you get to know why it is only during ovulatory cycle and why OCP, that's oral contraceptive pill, work as a sort of relief for people with dysmenorrhea. Okay, at this point, please, if you have not subscribed to this channel, it is better you do so now. Thank you for watching my videos. Thank you for always following me. Please watch other videos, like them, share them. Don't be selfish with the information you are receiving here. Click on that subscribe button and turn on the bell notification to know when I drop the next video. Now let's go back to what we are talking about. Now we are talking about primary dysmenorrhea. So primary dysmenorrhea occur around 15, I said between 48 to 72 hours, and some may have it before their menstruation. Some may have it some hours before their menstruation, and around 15% of ladies or women or female, with dysmenorrhea, primary dysmenorrhea, have severe pain. They have severe pain. They may also have nausea and vomiting. Nausea is like feeling to throw up, feeling like vomiting, and they may also vomit or throw up, and they also have dizziness and diarrhea. So that is to be noted. And for treatment, we take the treatment together at the later part of this video. Please make sure you watch to the end. Okay, thank you very much for that. Let's go to number 2, the secondary dysmenorrhea. Secondary dysmenorrhea is that dysmenorrhea that is experienced as a result of pathologic process. What is pathology? Pathology is disease condition. Don't be swayed by the big grammars, big medical jargons. Pathology is disease condition. And what are the causes? What are the disease conditions we are talking about here? We are talking about endometriosis, adenomyosis, pelvic adhesion, infection, pelvic congestion, cervical stenosis, psychological stress and disturbances. So these are the secondary, these are pathological processes that may result in secondary dysmenorrhea. So I've talked about endometriosis. What is endometriosis? Endometriosis is the presence of endometrial stroma and glands outside the uterus. Ordinarily, there are stroma and glands inside the uterus. In the lining of the uterus, it is called, the lining of the uterus is called endometrium. But when these trauma and gland are found outside the uterus, it is called endometriosis. So this may cause severe pain. Okay, still talking about endometriosis. Endometriosis may cause intra-abdominal bleeding or hemorrhage, fibrosis, and adhesion formation. It leads to dyspareunia, that is painful intercourse. It leads to infertility and pelvic pain. So how do you know? You may not know until you go to see your doctor. Your doctor will diagnose you and tell you you are having endometriosis. Endometriosis is not it is just wish or just a thing. I've listened to a program, I've watched a video. No, please go and see your doctor to diagnose it for you. Then he will be able to know what to do. Now, the pain of endometriosis, we are talking about secondary dysmenorrhea now. The pains of endometriosis start 2 to 3 days before menses. You see, it is very serious, very, very serious, and it is worsened during menses, during menstruation. You know, it is very, very painful. It is very, very painful. And to diagnose it, your doctor or your gynecologist may have to use laparoscopy, to look through a special instrument to know, there may be medical or surgical intervention and so on and so forth. So we are still talking about secondary dysmenorrhea, and that is endometriosis. The next one is adenomyosis. Adenomyosis is the presence of ectopic endometrial gland and stroma in the myometrium of the uterus. Myometrium of the uterus is the middle, the inner, not the inner. The inner is the endometrium. The middle. Uterus is divided into 3: the outer, the middle, and the inner. So the what we are talking about now is the middle, the myometrium. So instead of having the stroma and gland outside, like in endometriosis, this time around they are located in the myometrium, middle of the metrium of the uterus. So, and that causes serious pain during menstruation. It causes serious pain during menstruation. Now, the symptom that you may feel is dysmenorrhea. That's number one. Don't forget we are talking about dysmenorrhea. And the second one is menorrhagia, excessive bleeding. It's heavy menstrual bleeding, menstrual flow. So once you notice that, you need to consult your doctor. We need to know what to do. He may ask you to go and do pelvic scan, pelvic QSS. May ask you to do MRI, HSG, and histologic evaluation of the tissue, and so on and so forth. But please, whenever you see pain and heavy bleeding during your menstrual flow, consult your doctor. Okay, let's go to another. Let's go to cervical stenosis. In cervical stenosis, menstrual flow is impeded, is occluded at the level of the internal cervical os. In the cervix we have the external cervical os, we have the internal cervical os. But at the level of internal cervical os, there is stenosis, there is narrowing. That's why it is called cervical stenosis. There is narrowing. So the narrowing may prevent the free flow of blood, and there may be accumulation of blood in the uterus. Well, cervical stenosis may be as a result of congenital abnormality. Some people are born that way. Maybe because it may have been as a result of trauma, injury, or infection or surgery, like D&C and so on and so forth. So cervical stenosis is one of the causes of primary dysmenorrhea, and diagnosis can be made in the presence of hypomenorrhea, hypomenorrhea. The menstruation, the flow is coming in scantily. It's not rushing as it should be, and there is severe pelvic pain. So your doctor will know. We have to examine you vaginally to look at using speculum and some other instrument to know if if your cervical is really stenose or narrowed at some point that is not allowing your blood to flow freely, your menstruation to flow freely. Where we have pelvic inflammatory disease, that's another indication for secondary dysmenorrhea. Pelvic, that the one people call PID, STD. It is infection caused by chlamydia, Neisseria, gonorrhea, and mixed infection. So any infection in the pelvic of a female, that will lead to progressive pain. This infection will come in gradually, maybe from the vaginal environment, and begin to make its way, begin to progress, to the uterus, to the fallopian tube, and so on and so forth. It is called pelvic inflammatory disease, and this can cause secondary dysmenorrhea. So another causes are pelvic congestion syndrome and fibroid. Fibroid are benign tumor. They are tumor. They may be inside or outside or in the wall of the uterus. How do you know all this? You have to visit your doctor. We do some tests and order some investigation like pelvic scan, MRI, and so on and so forth to be able to arrive at this diagnosis. Okay, no. How do they present? Generally, they present as aching pain in the abdomen. That is dysmenorrhea generally. Now, can it be prevented? The answer is no. Some things just happen, and they call it the etiology is idiopathic. That is, nobody can explain why it happens. Nobody. So you cannot prevent it. It's not preventable. It may come, but once you have it, you know what to do to lessen the pain and so on and so forth. So the presentation is like you have a aching pain in the abdomen, you have feeling of presence, that is feeling of pain in the or pressure around your lower abdomen, not in the middle of the one you call stomach. It's not stomach, it's abdomen. So in the your lower abdominal part, so you have serious pain there, and the pain may radiate to your hips, to your lower back, and your inner thigh, and they may be throwing up, like I said earlier. So these are the presentation of dysmenorrhea. Then what to do? What do you do when you have dysmenorrhea? There are home remedies, simple things to do. But when home remedies fail, what you do is to see your doctor. Very, very important. See your doctor. He will examine you, do some clinical examination, vaginal examination, send you for some special tests. So which will help you and which will help him to diagnose your condition correctly. Now, what are the danger signs? The danger signs are increase in temperature. When you begin to have increase in temperature, you are throwing up, you are vomiting, you are having diarrhea, you are having a fainting attack, or you are actually fainting, or you are having dizziness. And not only that, you have a rash like a sunburn. Please don't wait at home. Go and see your doctor immediately. These are danger signs. Your menstruation is so heavy and you are having serious pain. Don't take it for granted. Go and see your doctor. Now, how is this condition managed? Let's talk about home management, the things you can do, especially if you are just experiencing it after menarche, maybe 6 months or 2 years after your menarche. You are experiencing it as a young lady in secondary school, because this may prevent you from going to school. What to do is, 1, you can take what they call NSAID, NSAIDs, that is non-steroidal anti-inflammatory drugs like ibuprofen, like ephedrine, like paracetamol, and so on and so forth. But if the symptom is not okay, if there is not if you are not okay, you need to see your doctor. That is the truth. So you can get, we call inside, most of them are OTC, over the counter drug. You go to chemist, you go to pharmacy, they give it to you, you use them. You can start taking them maybe from some hours before your menstruation, once you are feeling your menstruation is coming, you can take it, or at the onset of menstruation they may give you a relief. Then apart from that, you can also have a heating pad or hot water bottle. Just place them around your lower abdomen. Put them around your lower abdomen. Heating pad. Or another thing to do is you can pour rice inside a sack, rice, then eat the rice, then put it gently on your abdomen. But if that will be too difficult for you to do, just look for hot water, pour it, or your towel at home. If you are at home, you can sprinkle water on your towel, then use your iron it. It will give some kind of heat, then place it under your abdomen. You will feel instant relief. That is in primary dysmenorrhea. You feel instant relief. Another thing to do is you can rest. This is very important. Then avoid caffeinated drink, smoking, and alcohol. These have a way of exacerbating your condition, so avoid them generally. Another thing to do is to massage your lower back, massage your lower abdomen, massage it. Then make exercise your regular thing. Do exercise. Ladies that do exercise have less menstrual cramp, so it's very important for you to note. So then you can get some insiders, ibuprofen, and some other drug, any type you like, you can take. So it's very important. And then I said it cannot be prevented. That is sure. It cannot be prevented. You can't do anything to prevent it. Maybe from day one, say, no, I don't want to have dysmenorrhea. If you will have it, you will have it. If you will not have it, you may not have it. So once you start having it, you just look for the way out of it. So rest, eat good and balanced diet, put eating pad or hot water bottle on your lower abdomen. Another thing, like I said, you can do is to soak your towel in hot water, not too hot that will burn your skin. Squeeze it, place it gently around your lower abdomen, or you sprinkle water if you are where there is electricity and you have access to pressing iron. Just use your iron, iron the towel. It will give you some heat, and place it around your lower abdomen. And the third one is membranous dysmenorrhea. In membranous dysmenorrhea, all the content of the menstruation, just like the shape of your uterus, comes out from your vaginal orifice. This is serious. It's not common, really. It's not common. We have about 2 or 3 or 4 cases reported, but it is still part of dysmenorrhea. So that one may be as a result of taking some pill or whatever. So whatever you are doing in membranous dysmenorrhea that is causing your pain, once you stop taking it, everything goes away. So dysmenorrhea is a very serious condition in women. It made them miss school, it made them miss work. It leads to loss of economy and so on and so forth. Please share this video with your friends and your family, with everybody around you. Let them see it, especially the young adolescents, young adults, female that are having their menstruation. Let them know the home remedies to dysmenorrhea. And by doing that, you are helping somebody. So thank you very much for watching this video. Thank you for always watching my videos. Do well to watch